Here now, Dr. Timothy Quinn, a family physician and board certified obesity specialist, to talk more about it. Thank you, as always, for being here. What's your message on a product like Zyn?
Well, a product such as Zyn, which is not regulated by the FDA, does not have the research to back up the safety. I've had a great deal of patients that have come to me to ask about this product because I am an obesity weight loss specialist and they're looking for alternatives because a lot of people can't afford the Ozempic or the Wegovy because in a lot of cases the insurance does not cover it. They're looking for alternatives. And as a physician, I'm sharing with my patients that the research, the safety is not established. The main ingredient of these nicotine pouches, the Zyn, is the nicotine. And nicotine is associated with leptin, which is a hormone in our bodies that help us get full quicker, meaning that we typically will eat less, which is behind a great deal of the success of individuals losing weight on this medication. But what I share is the nicotine can also cause increased blood pressure, increased heart rate. And for those patients that have underlying cardiovascular disease, it puts them at a higher risk of having a heart attack or a stroke.
And it's not just young people who are interested in Zyn for the cost. You're having patients of older age groups come to you and ask about this?
Most definitely. So many patients come to our clinic in Mississippi that are seeking a healthier weight. These are individuals that are living with obesity, and a lot of the insurances are not covering the the FDA-approved weight loss medications to include the Wegovy and your Zepbound, which have been clinically research proven as far as benefits outweighing the risk in regards to safety. A lot of people are looking for alternatives, such as the Zyn. And as a family physician, I'm always going to lead my patients in the safest direction and advise them to not try products that have not been researched. These products have not been properly researched, and there's a lot of correlation as far as associations in the reports showing that people that use these products, they'll receive a surge of dopamine because of the nicotine, and a lot of people will get a high or a sensation of feeling good, but it's short-lived. And when it stops, and then some of these people can develop anxiety and irritability, and there's also a concern of addiction, especially with our younger people using these products, such as these Zyn nicotine pouches that are scarily being marketed to the younger people, because young people, they're using social media, and a lot of these social media posts make these products seem like they're cool. They're the thing to do. I actually studied TikTok today and looked at a lot of the videos, and they were quite convincing to, in my opinion, to a younger person that wants to just do the thing that's cool right now.
Yeah, don't be fooled by the price or by the promise of weight loss. The promise is a nicotine addiction, and it comes with a lot of health risks. When it comes to the cost of the drugs that are approved and that you are prescribing to patients, Ozempic and some of the others, what's on the horizon for those drugs, Dr. Quinn? Will the price come down?
The good news is I actually did a report on this network where we talked about the new research with the GLP-1s to include your Wegovy, and it showed cardiovascular benefits. The FDA has since given the clinical indication for FDA for cardiac benefits with Wegovy, and because of this, some of our insurances are now covering the Wegovy for weight loss. If you can document that the person has had a stroke or a heart attack in the past, because now what's being discovered is the medicine does not only help you lose weight, but it can help you live longer, and it can actually save your life. And that's when insurance companies are more likely, and they are starting to buy in more to cover these medications so we can get these medications to people that so much need it.
The one question that we often get, I'm sure you do, is what happens when you go off the medication? What are the long-term outcomes for somebody who's been on these medications? Do we yet know the answer fully to that?
Unfortunately, a lot of the research is documenting that people that take the medication that lose a great deal of weight, a lot of these same individuals will gain the weight back. That's why it's so important that this medicine is prescribed by a physician that has experience in weight management they don't necessarily have to be board certified, but they need experience so that they can incorporate not just the medicine, but also lifestyle changes such as diet and exercise along with counseling so that the person can get new lifestyle changes. So when they get off the medicine, they can continue those lifestyle changes and they can keep the weight off and have a healthier life that they deserve.
Yeah, lifestyle changes includes lots of things, including diet and exercise. Dr. Quinn, thanks for the messaging on this important topic. I know a lot of people are listening.
Hey, thank you so much for having me.